Today what we're going to talk about is pre-op instructions under local anesthesia. First, for the convenience and comfort of the patient, the surgery is going to be performed under local. For the following guidelines, they are offered to aid your understanding of the process and how you might better be prepared for it or help the patient be prepared for it. We need the patient to obviously give us a list of any medications that they're taking, even over-the-counter medications. Please do not take any medications without the doctor's knowledge and approval. This will aid in giving the doctor the knowledge to be able to prescribe the correct information for each individual patient. Make sure that the office staff is aware of any allergies or any illnesses that you may have prior to having the surgery. If the doctor says it's okay, please make sure you tell the patient to take the prescribed medications as well as the ones that have been prescribed for you in preparation for your surgery. Just before leaving home, prior to having your surgery, you should brush your teeth and then, using a ½ ounce of the Paradex oral rinse, swish in your mouth vigorously, especially where the implant is to be placed. You should spit the rinse out after you are done and do not swallow the rinse. It is also recommended not to take any blood thinners, including aspirin and even some vitamins and herbal supplements, which can be blood thinners as well, for at least 3 days prior to your surgery. For the comfort of the patient, we recommend that they wear loose-fitting clothes, comfortable clothes, and long pants, as it is cool usually in the operating rooms. We also ask that female patients remove any eye and facial makeup, lipstick, and nail polish, as it could interfere with the surgery. For those patients that have long hair, we ask that they refrain from putting them in ponytails or buns, as it could hinder them from laying down on the headrest. We also ask that the patients who are smokers, that they refrain from smoking at least 2 weeks prior to the surgery. If you are a smoker, there is a significant benefit from avoiding this after surgery. Smoking is known to delay wound healing for an extended period of time. We also recommend that the patient does not return to work or school on the same day as surgery. We would be more than happy to provide a doctor's excuse letter if necessary. If you feel that you are coming down with an illness or you have any allergies or anything that you think could be detrimental to having the surgery, please make the office aware of any of these allergies or illnesses prior to having the surgery done. It is much better to be safe than to have the surgery done and we have complications from these illnesses or allergies. Also inform the patient that it is recommended that they do not wear any contact lenses during the surgical procedure. If they have glasses, it is recommended that they bring their glasses to the procedure. Again, if you feel that you have symptoms such as stuffy nose, sneezing, headache, extreme exhaustion, fever, please inform us prior to having your surgery done. We would be more than happy to reschedule your procedure at a time whenever you feel more healthy. Unlike IV sedation, we only recommend that the patient refrain from eating 1 hour prior to the surgical appointment. It is okay to have a small amount of clear fluids, but refrain from things such as coffee or tea. For liability reasons, and of course judgmental reasons, we recommend and insist that any patient not drink any alcoholic beverages the day of the surgery. If any alcoholic beverages have been consumed, we will reschedule the treatment for another day. Typically, patients who have surgery under local sedation are able to drive home by themselves after this type of procedure. But if your appointment is much longer than an hour, then you may have some doubt how you might feel after your surgery. You may prefer to have someone drive you home. If you notice any disturbance or problems after you leave the surgery, please contact our office immediately. If you are a parent or guardian, please let us know after returning home and call us immediately. Even though you may not think that the issue is serious, it is better to be safe than sorry. It is also strongly recommended that after your surgical appointment, you go home and relax for at least a few hours. Remaining still, as well as the use of any small ice packs on your face, can significantly enhance your comfort. Heavy physical activity shortly after surgery can cause complications and pain. Also, it is important to notify the office if you develop a cold, sore throat, cough, stuffy nose, or fever, or anything else during the days prior to the surgical appointment. If rescheduling your appointment becomes necessary, we would like to have as much advance notice as possible. Please do not wait until the day before or the day of the surgery to notify us, thinking that you might get better. Most offices commonly start preparing items for your surgery several days in advance, so a lead time related to possible rescheduling is very important. Most offices require at least a 24-hour notice so we can have time to schedule other patients that may need to be in sooner. And finally, if you are under the age of 18, you must be accompanied by someone 18 years of age or older. Please have this person be prepared to stay in the office for the entire appointment as well as during your recovery at home that day.